Men over 50 spend billions on supplements marketed for prostate health, testosterone, and sexual vitality. As a urologist who reviews the medical literature regularly, I am giving you the honest truth. Which ones the evidence supports, and which ones are wasting your money. I am Dr. James Whitaker, board-certified urologist, and today I am going to give you the most honest supplement evaluation available for men over 50, because the supplement industry is built on exploiting exactly the health concerns that men in this age group carry most deeply. The marketing is sophisticated, the packaging is professional, and the claims are compelling. But when you evaluate these products against the actual published clinical evidence, the picture looks very different from what the marketing suggests. I want to establish my evaluation framework before naming the products I consider wasted money, because the framework matters as much as the conclusions. For any supplement to earn a positive recommendation from me, it must meet 3 criteria. First, at least one adequately powered, well-designed, randomized controlled trial must have demonstrated a clinically meaningful benefit, not just a statistically significant difference, but a difference that actually matters to patient outcomes in the relevant population. Second, the biological mechanism must be plausible and supported by basic science evidence. Third, the risk profile and drug interaction profile must be acceptable. A supplement that has a plausible mechanism but no clinical trial evidence gets acknowledged as theoretically interesting but not recommended. A supplement that has marketing claims with no mechanistic basis gets dismissed outright. With that framework established, let me name the 5 supplements that I consider the most significant sources of wasted money for men over 50 in the urological and men's health context. Wasted money number 1. Testosterone booster supplements. This is the largest and most financially predatory category in men's health supplements, marketed with claims about naturally boosting testosterone, supporting male vitality, increasing strength, and improving sexual function. A systematic review and meta-analysis published in the World Journal of Urology examined the clinical evidence for the 33 most commonly sold testosterone-boosting supplements in the United States. The investigators found that the majority of these products contained ingredients with no peer-reviewed human clinical evidence. Several contained compounds with potentially harmful effects. None produced effects on testosterone levels comparable to medical testosterone replacement therapy in men with documented hypogonadism. The few products that showed any effect on testosterone in small trials showed changes within the normal range, moves from, say, 300 to 320 nanograms per deciliter, that are clinically meaningless. Men with genuinely low testosterone, confirmed on morning blood testing, require proper medical evaluation, lifestyle optimization, and, in appropriate cases, physician-supervised replacement therapy. A supplement cannot replicate pharmacological testosterone replacement. Wasted money number 2. Multi-ingredient prostate health formulas. These products, typically combining saw palmetto extract with beta-sitosterol, Pygeum africanum bark, stinging nettle root, pumpkin seed oil, and zinc, are marketed with BPH symptom relief claims and sell extremely well in the over 50 demographic. I covered saw palmetto specifically in a dedicated video, but the summary is that the 2 largest, most rigorous randomized controlled trials of saw palmetto extract, the STEP trial with 225 men over 12 months, and the CAMUS trial testing multiple doses, both found no significant difference from placebo on any validated urinary symptom outcome. The evidence for most other ingredients in these blends is even thinner, single small studies or laboratory evidence without clinical translation. These products are not harmful in most cases, but spending $40 to $80 monthly on a formula whose primary active ingredient has failed 2 large NIH-funded trials is not a defensible use of anyone's health budget. Wasted money number 3. High-dose vitamin C supplements. At doses above approximately 500 milligrams daily, and certainly at the 1,000 to 2,000 milligrams commonly sold, vitamin C supplementation raises urinary oxalate excretion significantly. Oxalate is the primary component of calcium oxalate stones, which represent approximately 80% of all kidney stones. Multiple prospective studies, including large cohort data from the Health Professionals Follow-Up Study, have found that vitamin C supplementation at or above 1,000 milligrams daily is associated with increased kidney stone risk in men. For men who have already had a calcium oxalate stone, high-dose vitamin C is specifically contraindicated. For men who have never had a stone, supplementation beyond standard dietary levels carries an unnecessary risk without meaningful benefit. The evidence for high-dose vitamin C supplementation producing clinical benefits in healthy adults eating a normal diet is not convincing. Please subscribe to this channel right now. I am Dr. James Whitaker, And this is the kind of evidence-based, clinically honest content I produce every single week. Hit subscribe, hit like, and comment below. What supplement are you currently taking that you are wondering about? Name it. I will address specific supplements in future videos based on what I hear from you. Your comment matters. Wasted money number 4. Collagen supplements marketed for prostate or sexual health. Collagen supplements have become enormously popular for skin, joint, and general wellness applications. And some manufacturers have expanded their marketing to imply benefits for men's sexual and urinary health. The biological reality. Oral collagen peptides are hydrolyzed by digestive enzymes in the gastrointestinal tract into constituent amino acids before absorption. These amino acids are then distributed throughout the body based on metabolic need. They do not selectively concentrate in prostate tissue, penile tissue, or the bladder. The clinical evidence for collagen supplementation producing any measurable benefit for urological outcomes is essentially non-existent. For men eating a reasonably varied diet that includes fruits, vegetables, whole grains, and protein sources, most micronutrients are adequately supplied through food, and adding a broad-spectrum multivitamin at low doses adds little meaningful benefit. The exceptions are specific nutrients that are frequently deficient in older men, and I will address these in the supplements that actually work section below. Now, 3 supplements that I consider genuinely worthwhile for men over 50 based on the evidence I have reviewed. Supplement that actually works. Number 1. Vitamin D at therapeutic doses. Vitamin D deficiency is extraordinarily common in older men. Estimates suggest that 50 to 60% of American adults are vitamin D insufficient, with elderly, indoor-dwelling, and dark-skinned individuals at highest risk. The consequences of vitamin D deficiency in men are significant and well documented. Reduced testosterone production, since vitamin D receptors are present on testosterone-producing Leydig cells, and vitamin D sufficiency is associated with higher testosterone in multiple population studies, found that men with vitamin D deficiency who supplemented to achieve normal serum levels over 12 months showed significant increases in both total and free testosterone. The recommendation: have your 25-hydroxy vitamin D level tested. If it is below 30 nanograms per milliliter, supplement with 2,000 to 4,000 IU of vitamin D3 daily. Toxicity requires sustained intake above 10,000 IU daily for extended periods. The doses I am recommending are safe. Supplement that actually works. Number 2. High-quality omega-3 fatty acids. The evidence base for omega-3 fatty acid supplementation, EPA and DHA from marine sources, is the most compelling of any supplement I regularly discuss. EPA and DHA have well-documented anti-inflammatory effects mediated through prostaglandin and leukotriene pathway modification. Intraprostatic inflammation is recognized as a contributing factor in BPH progression. Multiple epidemiological studies have found associations between higher marine omega-3 intake and reduced prostate cancer risk, particularly for aggressive disease. The Reduce-IT trial demonstrated that high-dose prescription omega-3 supplementation reduced major cardiovascular events significantly in men with elevated triglycerides, and cardiovascular health is deeply interconnected with erectile and sexual function. For men not consuming fatty fish 3 times weekly, supplementation with 2 to 4 grams of pharmaceutical-grade, third-party tested fish oil provides a meaningful intervention with excellent safety. Choose triglyceride form fish oil. This form has superior bioavailability to the ethyl ester form commonly found in budget products. Supplement that actually works. Number 3. Magnesium glycinate. Magnesium is involved in over 300 enzymatic reactions in the body, and magnesium deficiency, which is common in older men eating processed food diets, has specific relevance to men's health. Magnesium is required for adequate testosterone synthesis, supporting the enzymatic function of steroidogenesis. Studies have found positive correlations between serum magnesium and testosterone levels in older men, and magnesium supplementation in deficient men has been associated with modest testosterone improvements. Choose magnesium glycinate specifically. It has superior bioavailability and minimal gastrointestinal side effects compared to the cheap magnesium oxide in most products. I am Dr. James Whitaker. Save your money on the products I described as wasted money. Spend it on the ones with real evidence, and spend the rest on whole vegetables, fatty fish, regular exercise, and sleep. Subscribe for weekly evidence-based content. I will see you in the next video.